I want you to take a second and imagine checking your mail and finding a letter from your insurance company. You've been with them for 5 years, you like your doctor, and you finally figured out how to use your dental and vision perks. But the letter says that as of next year, your plan will no longer exist in your county. They're effectively firing you. For a long time, this was a rare story, maybe something that happened in a small, isolated town once in a while. But as we sit here in the middle of May 2026, this is becoming the reality for nearly 3 million people. We are entering what experts are calling a period of high volatility, and if you live in a rural area or a state like Vermont, the ground is literally shifting under your feet. I've spent the last week looking at the new crosswalk and landscape files from the government, and the numbers are honestly a bit staggering. For 20 years, Medicare Advantage was the growth machine of healthcare. It seemed like every year there were more plans, more freebies, and more $0 options. But for 2026, we are seeing the first real market correction. About 10% of all people in these private plans are facing what the government calls forced disenrollment. It's a clinical-sounding term for a very messy, stressful experience. It means your insurer is packing their bags and leaving your zip code, and they're leaving you to figure out what comes next. Why is this happening now? Why are the same companies that were begging for your business 2 years ago suddenly pulling out? It's a perfect storm of 3 things. First, the government is finally tightening the belt on how much they overpay these private plans. For years, the plans were making record profits, and the government has decided that money needs to be reined in. Second, we have the new $2,100 drug cap that started this year. It's a wonderful benefit for you, but it's a massive new cost for the insurance companies. They are now on the hook for billions of dollars in medication costs that used to be paid by the government or the drug manufacturers. And third, people are simply using their health care more. After the disruptions of the last few years, seniors are finally getting those knee replacements and heart procedures they put off, and the insurance companies are seeing their profit margins shrink. When a private company stops making a profit on a specific plan, they don't stick around out of the goodness of their hearts. They exit. And when they exit, the choice we were all promised starts to look a lot more like a desert. I want to talk specifically to those of you in rural America because you are getting hit the hardest. In big cities like New York or Los Angeles, if one plan leaves, there are 20 others waiting to take its place. But in rural counties, we are seeing Medicare deserts form. In 2026, rural enrollees are nearly twice as likely to have their plans terminated compared to people in the cities. I've talked to families in places like Vermont where 90% of the Advantage market has basically vanished. When that happens, you don't just lose a plan, you lose a network. You lose the specific agreement that allowed you to see your doctor without an out-of-network bill. This is where the stress really sets in for adult children helping their parents. If your mom is in the middle of a cancer treatment or waiting for a surgery and her plan exits, you aren't just shopping for a new price. You're fighting to keep her medical team together. If the remaining plans in the county don't have her doctor in their network, you're back at square one. It's a massive disruption in care, and it's happening at a scale we haven't seen since the program began. What really gets me is how this collides with the new 2026 Part B costs. For the first time in history, the standard Part B premium has broken the $200 barrier. It's $202.90 this month. When you add that to the fact that the Part B deductible jumped to $283, the cost of living for a senior is becoming a weight that a fixed Social Security check can barely carry. I've spoken to so many people who feel like every time the government gives them a cost of living raise, the healthcare system just reaches in and takes it back. If you are forced out of a $0 Advantage plan and the only other options in your county have a high monthly premium, your retirement budget just took a hit that you didn't plan for. So what do you actually do if that termination letter shows up? First, do not panic, but do not wait until October to act. When a plan exits a market, it triggers a special enrollment period. This is your legal right to move into a different plan, or more importantly, to move back to traditional Medicare. And this is a huge detail that people often miss. If your Medicare Advantage plan ends, you often have a guaranteed issue right to buy a Medigap supplement plan without any medical questions. This is a rare and powerful window. If you've been wanting to get out of the network game and go back to original Medicare so you can see any doctor in the country, this forced exit might actually be your best opportunity to make that switch safely. But you have to be careful with the timing. You usually have a window of about 60 days before and after the plan ends to make this choice. If you miss it, you lose that guaranteed issue protection. And if you have a pre-existing condition, you might never be able to get a Medigap plan again. I always tell families to treat that termination letter like an emergency. Sit down with a Medicare counselor or a trusted advisor and look at the Medigap versus Advantage math. In a market where private plans are fleeing, the stability of original Medicare, where you aren't at the mercy of a private company's profit margin, is looking better and better to a lot of people. While we are talking about transitions, we have to look at the Medicaid side of the house. In 2026, we are seeing a massive wave of Medicaid audits. Because of some new federal rules around community engagement and work requirements that are being phased in for 2027, states are being much more aggressive about checking who actually qualifies for Medicaid right now. If your parent is dual eligible, meaning they have both Medicare and Medicaid, they are at risk. If they lose their Medicaid because of a paperwork error during one of these audits, they also lose their extra help for prescription drugs. Suddenly, that $2,100 cap feels like an impossible mountain because they have to pay the full deductibles and copays that were previously covered. I cannot emphasize this enough. If your parent gets a yellow or red envelope from the state health department this summer, open it immediately. It's probably an audit. They might be asking for a bank statement or a proof of residency that you've already sent 5 times. It doesn't matter. Send it again. I've seen people lose their life-saving medication coverage over a missing signature on a 3-page form. The system in 2026 is moving toward more automation and less human oversight, which means it's easier than ever to get lost in the gears. And then there is the star rating trap. In April, the government released the finalized star ratings for 2027, and a lot of plans saw their scores drop. Why does that matter to you? Because a plan with a low star rating gets less money from the government. When they get less money, the first things they cut are the extras, the grocery cards, the gym memberships, and the dental allowance. If you see your plan's rating drop from 4 stars to 3, that is a signal that your benefits are going to be slashed next year. It's also a signal that the insurer might be planning to exit your county next. They usually let the star rating slip before they officially pull the plug. I want to spend a few minutes talking about the observation status problem, because as hospitals get more expensive in 2026, this is becoming a frequent nightmare for caregivers. The Part A deductible for a hospital stay is now $1,736. That's a big hit. But if your parent is in a hospital bed and the paperwork says observation instead of admitted, they aren't even in the Part A system. They are being charged under Part B. This means you're paying 20% of everything, and you don't get the 3-day inpatient credit you need to have Medicare pay for rehab later. I spoke with a daughter in Ohio recently whose mother was in a hospital bed for 5 nights. When it was time to move her to a nursing home for physical therapy, the hospital told the family it would be $15,000 out of pocket. Why? Because even though she was there for 5 nights, she was never admitted. She was under observation the whole time. This is a technicality that is being used more often in 2026 to save the government money. but it is devastating for families. You have to be the advocate. Every single morning you should ask the nurse or the doctor, "Is my parent an admitted inpatient today?" If they say no, ask them why. Ask what medical criteria are missing to get them officially admitted. It is the most important question you can ask during a hospital stay. What really gets me about the 2026 landscape is how much of the burden is being shifted onto the adult children. You are the ones who have to read these termination letters, navigate the Medicaid audits, and argue with hospital discharge planners. It's a lot to ask of someone who is also trying to work a job and raise their own kids. That's why I keep coming back to the idea of a Medicare binder. You need one place where you keep the current plan details, the list of medications, the recent tax returns for IRMA checks, and a log of every conversation you have with the provider. In a year of high volatility like this one, your memory is not your friend. The paperwork is. I also want to touch on the new advanced primary care management services that started being covered this year. This is one of the few bright spots in the 2026 handbook. Medicare is now paying doctors a monthly fee to coordinate care more closely. If your parent's doctor offers this, take it. It gives you 24/7 access to a care team and someone who can actually help you navigate these transitions. In a year where plans are exiting and networks are shrinking, having one professional who actually knows your parents' history and can advocate for them is worth its weight in gold. As we look toward the summer, I want you to do a mid-year audit of your parents' health care. First, check their Part D spending. Are they close to the $2,100 cap? If they are, start planning for those $0 refills this fall. Second, check the plan finder on Medicare.gov in late summer to see if any early warnings have been posted about plan exits in your county. Third, look at their Medicaid status. If they haven't had a renewal in the last 12 months, an audit is likely coming. The 2026 environment is all about being proactive. We can't just sit back and wait for the open enrollment period in October anymore. The market is moving too fast for that. If your insurer decides to leave in May or June, you need to be ready to act in July. It isn't fair that you have to be a part-time insurance expert just to keep your parents healthy, but that is the reality of the system we have right now. What honestly worries me the most is the downward spiral we saw in Vermont. One plan left, which made the remaining plans more expensive because they had to take on all the sickest patients. Then those plans became unprofitable, and they left too. By 2026, there were almost no private options left in some areas. If you live in a state where this is happening, you have to start looking at the traditional side of the house. Original Medicare with a Medigap plan is the only way to insulate yourself from these private market collapses. It might cost more per month, but it doesn't exit your county, because the government isn't trying to make a quarterly profit on your dad's heart medication. I know this is a lot to take in. It feels like the safety net is getting thinner just as we need it the most. But information is the only thing that fills those holes. When you know that 3 million people are losing their plans, you aren't surprised when the letter arrives at your house. You're prepared. You know that you have a special enrollment period. You know you have guaranteed issue rights. You know that you can fight back against observation status. You are the navigator, and even though the waters are choppy, you have the map. I really want to hear from you in the comments. Have you received one of these termination letters yet? Are you seeing your favorite doctors leave the networks in your town? And for those of you in rural areas, what are the options looking like for next year? Sharing your real-world experience is what makes this channel work. It's how we spot the trends before the government even admits they're happening. Every story you share helps another family who is staring at that same red or yellow envelope, wondering what to do. Navigating senior health care in 2026 is a full-time job, but it's the most important work you'll ever do for your family. It's about protecting the safety and the dignity of the people who raised us. It requires us to be smarter than the algorithms, faster than the paperwork, and more persistent than the insurance companies. It's a heavy lift, but I'm going to keep digging through these crosswalk files and budget bills to make sure you have the blueprints you need. Take a look at that mail today. Check your parents' explanation of benefits for their drug spending. And don't be afraid to ask that hospital doctor the hard questions about admission status. You are the advocate, and in 2026, that is the most powerful position in the entire healthcare system. Protect the paperwork, verify those forced disenrollment dates the moment you hear about them, and always ask one better question before the next decision. Taking these 25 minutes today to understand the great Medicare Advantage exit is the first step toward a more stable year for your family. I'm so glad you spent this time with me. I'll see you in the next guide.